So we're speaking today to Dr. Angela Pine, who morphed from a research scientist and is really focused on creating a business around at-home HPV testing. Talk a little bit about that. It is incredibly common. Most people likely don't know they've ever had it. So what should people know?
What people should know is HPV, or human papillomavirus, is ubiquitous. Most sexually active people will have been exposed to it at some point in their lifetimes. Right now, the standard protocol to check for cervical cancer is to do a pap smear with or without an HPV test every couple of years, depending on age and other risk factors. So this is what we do in office, but the protocols for testing have become quite onerous and quite confusing because there are multiple different paths that can be taken. People have so many questions about their HPV status, and so something where we can be testing people at home really might be super helpful.
So for people who are trying to connect in some way their behavior to the likelihood of their getting HPV, it sounds like there shouldn't be judgment involved. It's everywhere. Does it have to do with any sexual behavior or choices or using protection versus not? What should people know if they want to reduce their risk?
Yeah. Well, look, like I said, most people are going to be exposed at some point. It's typically associated with sexual activity. However, there are people who have been exposed to HPV without being sexually active, and hopefully they're giving us the real story. In general, healthy lifestyle, stress reduction, avoidance of things that might alter immune system, like too much alcohol or smoking, multiple sexual partners certainly increases risk of exposure, but condom use is helpful to diminish this risk. However, it doesn't obliterate it because, after all, HPV is a skin-to-skin transmission type of virus. So condom use will not fully protect, since skin-to-skin contact will still be present.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Sherrill. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are delighted to welcome our guest today, Dr. Angela Pine, who is a research scientist and a founder of Tenzyme, and has spent a large part of her career, if not all of it, really focused on finding better solutions for women's health. Welcome.
Thank you very much. It's great to be here.
So you had a more linear path than many of the people that we spoke to, going from a career in research science into creating a company focused on women's health. Tell us a little bit about your background, how you got interested, and how you decided to take that experience and parlay it into creating a company.
Yeah, well, even though my path has been a little bit more traditional in terms that I'm a research scientist, I actually started off working in prostate cancer research. So I kind of went from the male side, and I've now sort of switched into women's health, shall we say, but I did have I always kind of worked in the background on women's health. So I started after my undergraduate degree researching new treatments for prostate cancer. So that was end-stage prostate cancer as well.
And how did you get from, was there a moment where you said the work that you were doing in prostate cancer related, or was there a personal experience? What caused the pivot, if you will?
Yeah, so when I was working in prostate cancer, I actually was developing a gene therapy, and I actually specialize in using certain molecules that can be used as a gene therapy. So alongside prostate cancer, I was also working on targeting the oncogene of HPV 16, which was driving cervical cancer, obviously. So that's kind of how I got into the more women's health side of things. And then as a woman, things started happening in my sort of life or had happened that sort of made me think I could actually use what I'm doing to kind of help more people that have been in my situation or that are going to be in other situations that really they don't really know where to go or what to do. So that's kind of how it all came around. Was I started working with cervical cancer in developing therapeutics, but then COVID happened and I actually pivoted from therapeutics into diagnostics. And I started developing COVID diagnostics, but also in the background, still working on cervical cancer. So that's kind of how it all sort of panned out.
I get asked about HPV in my practice all the time. So for our listeners, HPV is a virus. It's essentially ubiquitous. I think you would probably agree with that, right? It's something that, most people who have ever been sexually active have been exposed to. And, we're learning so much more about it as time goes along, but really it's related to female cancers like cervical cancer, vaginal cancers, which are much rarer, oropharyngeal cancers, particularly in men, penile cancers. We, of course, have vaccinations to help to address this. But maybe you can speak to exactly what your focus is. Is it in testing for this? Is it in a therapeutic for HPV? Because I'm sure people would be interested.
Yeah, so as I said, my focus is now mostly on diagnostics. So I'm actually developing a brand new technology to detect the high risk types of HPV. So as you said, there's many different types of HPV. I think there's over 200 now. And of those types, some are classed as high risk because they are known to be causative agents that lead to cancers. So there's about 15, I think now, different high risk HPV types. And I want to be able to detect any of those high risk types in women, predominantly in terms of cervical cancer screening. In the UK, I'm sure you're aware, we have a cervical cancer screening program, which is fantastic. And it now uses primary HPV screening to screen women for those high risk infections. So what I want to do is actually develop a diagnostic that could be used in women's homes. So taking the need to attend a doctor's surgery or practice completely out of the equation unless they test positive for high risk HPV. So that's really with the intention of getting more women through the door of even being screened for this virus that we know causes 99.8% of all cervical cancers. So
Right. So I'm wondering if in the UK, the screening for cervical cancer is as confusing as it's become here in the US, where there are multiple protocols that are acceptable for screening right now. What does that mean? Standard in past was always women come in at a particular age with maybe particular risk factors and have a pap smear, which is a swab of the cells of the cervix. They're looked at under a microscope, and if there are changes that might be consistent with HPV, further testing is potentially indicated. Now, with newer guidelines over the past couple of years, we are either screening women with a pap smear alone, a pap smear with an HPV test for HPV or that viral screening, the high risk types only, or just an HPV test, which has been slowly adopted here in the US. What's going on in the UK that makes this different? Is it easier? Are people just doing an HPV test? And the reason I bring this up is because your in-home testing is a fascinating thought, since right now a pap smear has to be done by a practitioner, which of course is, uncomfortable, and it's not cost efficient, of course.
yeah, exactly. So in the UK, I think we've got things a little bit more clearly sort of aligned in terms, we have this cervical screening program. So anyone between the age of 24 and a half to 64 is called for screening. They go along to their practitioner and have the smear test, as we've all been calling it for many years, which is the same examination, as you say, the scraping of the cells from the cervix, and then that's sent away. So in terms of the women going for the testing, as far as we're concerned, when we go there, we don't really know that too much has changed. But what's actually happening is when your sample gets sent away, what they do first is they test that sample for high-risk HPV infection. And then only if that sample tests positive do they return to the same sample, so you don't have to go back and get screened again. They look at the same sample and they look at the cells. They perform what you call as cytology and the pap smear. And then from that, they can determine if the HPV infection has persisted. It might have caused cell changes that can then lead to cervical cancer, and then provide any treatment that's necessary. So we do have a slightly more systematic approach. I think it's a little bit clearer, but still I talk to women now, and some, even though they've gone for their screening, still don't know what HPV is. They don't really understand what's going on. And this is in the UK, where we have a very clear system. You know, the education just isn't there. It's terrible, to be quite frank, that, you know, kids in schools are getting vaccinated for a virus that they have absolutely no idea what it is. Boys in the UK are being vaccinated for cervical cancer and wondering why when they don't have a cervix. I could talk for hours about the lack of education around this, but yeah, so we do have a slightly better sort of process for screening. I think that if we could provide an at-home test for HPV, that would help bring all countries in line with something that's a lot more straightforward. So you can just screen yourself for HPV at any point and know your status, which is fundamentally what any scientist that works in cervical cancer or HPV research wants women and men to know, is their HPV status.
So here's today's hot flash. Per the CDC, HPV, human papillomavirus, is so common that nearly all sexually active men and women get this virus at some point in their lives. I'm just going to jump in. I want to just confirm HPV stands for human papillomavirus. This is an extremely common virus. There are, like you said, probably more than 200 strains, some of which are low risk and probably will never cause any issue, and others which are high risk and have oncogenic potential, or they may cause some potential precancerous or cancerous changes.
And to build on that, Alyssa, describe to people who don't know how you might get it. You said obviously everybody's at high risk and there's so many different kinds. What behavior, if you will, or activities increases your chances or reduces your chances of contracting HPV?
Well, the truth of the matter is, everybody who has ever had sex ever in their lifetime will likely be exposed to HPV. This is just the fact. It's on the CDC website here in the US, and that's the usual. There are other ways to contract HPV. HPV can cause warts. Certain of the low risk strains can cause warts, genital warts, or other types of warts. You know, we know there are studies where nuns have had HPV. So either those nuns are not telling us their whole story, or there are other ways of contracting this, but it's mostly considered to be a sexually transmitted infection. The question that I get in my office all the time is, when did I contract this and who gave it to me? And the answer is, I don't know, because again, this could be contracted at any time of from sexual debut. And so it's often difficult to ascertain exactly when or from whom it was transmitted.
And for people who, again, are learning about this for the first time, which is lots of people around the world, are there symptoms? You know, there are many things that women experience where, you know, they're silent till they're serious. What you had mentioned, warts, obviously, which I'm sure anyone who's had HPV is familiar with, but what are the signs and symptoms someone should be aware of? And, you know, hopefully when we get this test in the market, they would get the results and then seek medical care.
Yeah. So actually, most people are asymptomatic until they have much more notable symptoms. So most people would not know that they've had HPV or that they currently have HPV, other than when they come in for testing. Yes, there might be visible signs of warts or growths, but most of the time it's microscopic changes that are occurring that we have right now either depicted on a pap smear when we look at those cervical cells under the microscope, or by having an HPV test, which is very commonly done right here. The issue that I would like to discuss with you is What do we do when we get a positive at-home test? Because this could really panic a lot of people, since a watch and wait and retest and surveillance type of recommendation is usually what's made. What type of education will be provided after an at-home test is positive so that we don't have mass panic?
Yeah, exactly. I think that it's really, this is why education is such a key point, and something that I feel so passionately about, is because if we test people for something that they don't fully understand and give them a positive result, as you say, it can create a lot of panic and a lot of worry. So what we want to do is also, we're going to provide an app for these people that are using this test, and it's going to have a lot of information. It's going to link to clinicians. In the UK, it will link to their NHS app and go straight to their GP surgery. So what would happen is you would actually then be prompted to go and attend your smear test if you do test positive. It's actually been noted that only 9% of people that are currently screened for HPV do test positive. So that's actually quite a small number of the people that are being tested. But if you do test positive, you would then go for your smear test, where they would examine your cells. And as you said, you can have this infection without knowing that you have it. And that's what makes it quite dangerous, because it can start over time to cause these changes to the cells that then will lead on to becoming cervical cancer. So yeah, it's important to then go and get your cells looked at. And that's, what we would prompt people to do as the next stage. So in terms of a business, what we're hoping is to increase the amount of people that are knowledgeable about their HPV status, and then obviously pushing less people through the doors for actual primary HPV screening, but then more people through the doors that do need to actually have their cells looked at. So
Understood. So that's great. Will your test be something that's covered by insurance, or in the UK by, the NHS system, or is it something that is self-paid?
Yes. So in the UK, obviously, we have the cervical screening program, as I said. So it's hoped that we will get our test adopted into the program in some way, shape, or form. That NHS can be a bit of a difficult beast to get us that into.
No surprise there.
Yeah, we're still hoping. We have a lot of interest from different people and stakeholders. So yeah, we're hoping that it will be part of the test, the screening program, where you would literally, at the moment, you get a letter, or you get a text message, or you get both from the screening service, telling you that you need to make your appointment. So in this, our vein of thinking is that what you'll have is a text message with a link saying, click here to order your pack, and it will drop through your letterbox a few days later. Which obviously takes a lot of the pain out of having to attend your smear test.
Sure.
And then, yeah, we also want to explore sort of more partnerships with healthcare diagnostic brands, things like that. So I'm sure you're aware that, decentralizing healthcare is kind of very on vogue, and it's something that a lot of us believe needs to happen. So we will explore those kind of partnerships as well.
Sure.
So one of the things we often see in women's health is, one, there's challenges with diagnosing, and if there is a delay in diagnosis, it can result in other more serious problems. So Alyssa and Angela, could you help people understand, if you have HPV and you diagnose it quickly versus you don't diagnose it quickly, what are some of the impacts? And the reason I ask that question is because we have so many people listening who are learning about PCOS and how, delayed diagnosis could have an impact on fertility. Same with the length of time it takes to diagnose endometriosis. Is there a parallel here with how much more serious the symptoms can get with later diagnosis?
I really want to jump in here, because I think it's very important to realize that most people with a healthy immune system are going to clear this infection without any repercussions. So that should be heard first and foremost. So keeping your immune status in a good place by getting enough sleep, avoiding things like tobacco, trying to keep your stress levels low, These are going to help your general immune function and therefore help your natural processes of clearing infection to really take hold. People who are immunosuppressed, who smoke, who have multiple sexual partners and they're unprotected and might have more risk of exposure are those who really would be considered to be in a slightly higher risk category. So those things are things to keep in mind. The other thing is that there are some people who have persistent HPV infection, and these are people who really need heightened surveillance and further testing. So I would assume these people are going to be picked up by your testing and, fostered into the actual provider's office to get further testing. But just because you have an HPV positive test doesn't mean you're destined for cervical cancer. It means that you just may need heightened surveillance. The other thing to keep in mind that I think is something reassuring to think about is that the progression of cervical cancer is very slow. So going from a positive HPV test to cancer is a very long timeline. And so there's loads of time to really intervene at times where preemptive measures can be taken. So that's very important. With that said, surely we don't want to ignore.
And Angela, as you are developing this, is there a line of sight as to when it would be available in the UK and then maybe more broadly? Obviously, our audience is global, but this is not a problem that's unique to the British health system.
Yeah, so I mean, we're at very early stages at the moment. So I'm hoping that we would be able to get something to market in the next 3 to 4 years. That's for the at-home test. We have some interim things that we want to sort of do in the meantime, replacing the way that actually labs test for HPV, for example, reducing the cost of that so that we're sort of getting some cost benefit into the healthcare system already. But yeah, so I estimate maybe 3 to 4 years.
So we're doing HPV testing all the time in our office. What's the difference between what you're trying to bring to market and what we're already doing? Is it just that it's an at-home thing? Is it getting the app up and running with the follow-up, or a little of everything?
It's actually, yeah, it's all of that. So at the moment, yeah, you're probably using one of the more kits along the lines of RT-PCR, things like that.
Mm-hmm. Yes.
And there's a few different methods that are available. Obviously, those require specialist equipment. They require trained personnel. They're quite expensive as well, at least in the UK they are. I'm sure they are everywhere else. So our test is really, we aim to get it to a point where anyone can use it at home. So similar to the way we were all performing COVID tests with lateral flow, although it isn't lateral flow technology, I have to stress that. So yeah, it's a new technology. And I think that it's quite important to also consider the reason why this hasn't happened up until now is because pre-COVID, the only things we tested for at home really were pregnancy.
Mm-hmm.
And that's because there wasn't much faith in at-home testing. Governments have obviously now seen that it has its place and it has its benefits. But still, when you're looking for a virus or something that's a precursor to cancer, there's a lot of sort of tape, I guess, to get through, because you don't want to give people false positives at home, especially when you're looking for things like cancers. So that's why a new technology is really required at this point, because lateral flow, for all its benefits during COVID, just isn't sensitive and specific enough to look for something like HPV that has the connection to cancer. So that's why we've developed a completely new technology that, yeah, hopefully we can put into people's homes and give them the reassurances that they need.
Any, given your background from researcher to now entrepreneur, are there any tips you have for people who might be thinking about that same journey? Obviously, some of the skills are transferable, and based on our experience, there are a whole lot that are new, that are required, and many, many surprises. Words of wisdom to people who are thinking about making this leap.
Yeah, I mean, I actually speak to sort of scientists that are just starting their careers, or research careers anyway, quite a lot about starting startups or spin outs, things like that. It's a really steep learning curve. I've learned so much, and I've only been doing it for probably about 18 months now. So yeah, you can never get enough information. And I personally attended a lot of things like venture builder incubators, accelerators, and they are worth their weight in gold. Just, it's a completely different way of thinking to being a scientist. And yeah, just get as much help as you can.
And one of the things that we find so affirming about this space is how many more companies are being created, how many entrepreneurs are being born, if you will, how many more investors are starting to get interested in this space. So again, we always refer to the theme that a rising tide raises all boats. We are actually thrilled with the work that you're doing. It's exciting. It would give people another option. We always talk about this, how we want to make sure, given Alyssa's background and all the things that she sees, that these options are meant to enhance the amount of information that people have and the choices that they have, not necessarily to supplant the role of the healthcare practitioner. So we'll really be watching and looking forward to this product making more progress and coming to market so that consumers have more options.
Yeah. No, it's exciting times, definitely.
Surely. And the at-home testing is all the rage right now. So what better test to have at home than HPV? Thank you so much for your hard work. And yeah, we really look forward to watching your progress.
Thank you very much.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.